In our last segment, we discussed the latest movement when it came to health care reform, and no one knows the political consequences of the health care debate as well as our next guest, John Faso, the freshman Republican from the Hudson Valley. It was his maneuver on New York's property taxes that vaulted him to national attention, whether it was wanted or not. A lot of it turned out to be negative, from crafting a special carve-out just to win the votes of New York lawmakers. Combine that with Faso's place as a freshman Republican in that swing district, and healthcare has, by all accounts, put him on the hot seat. Faso is hosting a town hall tonight when many of his colleagues have ducked them, and we spoke about that in healthcare earlier today. First off, why did you decide to have tonight's town hall? And I asked that in the context of what we just showed our viewers. A couple of your colleagues had some very angry crowds that they had last night throughout this country, and moreover, the vast majority of your colleagues have bailed on this altogether, given some of the angry responses they're hearing from their constituents when they're coming home. Why did you decide to do it?
Well, I thought that having a forum that would be on live television, that would allow constituents from my district to ask questions, anything they want, but do it in a format that would be civil and that would be respectful on both sides, would be the most efficient means and effective means of talking to the most constituents at one time. And I thought that a live TV opportunity with the public TV station would be a great way to do it.
In terms of the response you're expecting, I know you're a student of history. You know that first-time presidents of both parties usually face brutal midterms, in this case, next November. Moreover, you've seen all the polling data, you've seen all the stories. There's a palpable frustration out there with Republicans in control of every branch of government right now. They still have not gotten nearly as much done, certainly as the president promised, and also other Republicans as well. What kind of response do you expect tonight, given the reality of Washington and the reality of what hasn't gotten done?
Well, I think it's only 100 days into the Trump administration. I've been in Congress barely 3 months. And yes, there's a lot on our plate. A lot needs to get done. I was pleased the Senate confirmed Neil Gorsuch as the new Associate Justice of the Supreme Court. But we do have a lot of things to do: health care, tax reform, infrastructure, and I would put them in those order. Those are the things that we need to get done. And yes, the public will hold us accountable. But again, we're only 100 days into this administration, and I do think that we have time to address these things and do it hopefully on a bipartisan basis.
Well, let's talk about health care. And what was surprising, at least we heard yesterday, is that's still the first priority. The president, after the debacle, the last time health care was proposed, he certainly gave the signal originally that they were going to then pivot to tax reform first and get, as they said, a win on the board. Now they're coming back, and it looks like, and you can probably answer better than me, that health care, they're going to take another crack at it. But what the president said to the Wall Street Journal yesterday has gotten a whole lot of folks up in arms, that basically they're going to be doing cost-sharing reductions, that he's going to cut off that element of it. And he said that'll force Democrats to the table. I personally think that's a mystery. Democrats won't come to the table, and you could have 7 to 10 million people that will be impacted. You're in a blue state right now. Do you support this proposal to basically blow up Obamacare without a real path here that you definitely can have a replacement on the table?
No, I've said all along, I don't think we should quote unquote blow up the system. The system does have serious problems. It's failing in many places around the country. It is resulted in premiums doubling, deductibles. I met a family businessman recently whose premium went from $12,000 to $19,000, and his deductible went from $3,000 to $13,000. So these kind of things are not unusual. Yes, people have benefited from the ACA, but many people have not. So this is why I've said we should keep what works in the ACA and fix what doesn't. But I don't think blowing up the healthcare system, this is too important for families and individuals. I think Americans sent us to Washington to try to fix things, not to blow them up.
So the proposal you heard yesterday from the president, and seemingly with the support of House leadership, you're not in line with that? Basically, in effect, driving out a lot of the health insurers as a consequence of this move to try and drive Democrats to the negotiating table?
No, Richard, I'm not. And I haven't seen exactly that report in the Wall Street Journal, but I've said all along we need to fix it, not just simply throw the baby out with the bathwater.
You, along with Congressman Collins and other upstate New York Republicans, pushed to have basically a burden shifted from the counties to the state in New York as related to Medicaid. There's been a lot of pushback, including from state organizations representing both hospitals as well as the Healthcare Association for New York, saying, among other things, this was just shifting costs from the counties to the state, and moreover, that hospitals, nursing homes, assisted living facilities, they would be devastated to that. Are you still on board that that's good prescription for New York?
Well, those are just scare tactics that are coming from the Cuomo administration. Frankly, my amendment, and I proposed this last year when I was running, Richard, would give the state until 2020 to reform its program and do what 49 other states do, and take full responsibility for the state share of Medicaid and not foist it on the property taxpayers. Look, people in upstate New York are being driven out because there aren't enough jobs and their taxes are too high. And one of the reasons is this 50-year-old mistake started under Nelson Rockefeller, and I am to fix this because we should no longer impose the Medicaid burden on homeowners and commercial property owners throughout our state.
But explain to somebody who says, wait a minute, if somebody lives in the 5 boroughs, this doesn't apply to them, but it applies to people outside of it. So depending on the zip code, you will or won't be impacted by this? It doesn't seem that there's equity there.
Well, it's very simple, Richard. New York has $7.2 billion foisted on local taxpayers, but 5 of that is within New York City. New York City has its own local income tax. New York City is not complaining about the burden of Medicaid on its property tax like the 57 other counties are. And New York City is more like another state. Its budget is more than all of 8 or 9 other states in the country. So New York City is not your typical political subdivision. It has the capacity to do it, and it would be unfair, I think, to expect Albany to absorb all $7 billion of that local share of Medicaid by 2020.
You, I know, are well aware, though, that people are saying that sounds good, but there happen to be Democrats in the 5 boroughs when north of it there's more Republicans. It does seem that politically it's convenient that one part of the state faces the burden of this while the folks north of it don't. That was a deal basically to get your vote for that bill.
Not true. In fact, I worked on this amendment and I worked on other amendments that were proposed and added to the legislation as well that would help protect the Medicaid program for the disabled and for those living in nursing homes, that would protect those aged 50 to 64 from having spiraling health premiums. So there were many other provisions that brought my support. Something has been wrong with New York's Medicaid program for many years. This is one of the reasons why the spending is out of control, because the state has been able to foist some of its costs off on the local property taxpayers, and it's simply unjustified.
Well, I will say this, Congressman, I do appreciate and respect the fact that you will be taking questions tonight. A lot of folks are not doing the same across this country, and I think town halls are an important component to let the public's voice be heard. So I'm glad you're doing that tonight, and I'm also glad you made some time for us today. Thank you very much, Congressman.
Thank you so much, Richard.
And we'll have some clips of that town hall later on this evening for you tomorrow night. But now, love him or hate him, the one thing you do know about Donald Trump is he sticks to his positions no matter what. But I guess that was then and this is now. Not this week. The president is flipping on positions on a slew of fronts. Is he just giving in to the realities of the most difficult job in the world? Is he evolving? Or is something else here at play? We'll review and discuss straight ahead.